As the Ubuntu proverb says, people become people through other people. And as I say in my book, Face Buddha, we are who happens to us and what we make of the happening.
Welcome and thank you all for joining our discussion surrounding COVID-19. As many of us know already, COVID-19 originated in Wuhan, China, and has since spread across the world. Of the more than 67 million cases reported globally, just about 2.3% have resulted in death. People worldwide have contracted and spread this virus, yet individuals of Asian descent are seen as the largest threat of being super spreaders. This notion and the contributing factors keeping it alive is what we will be discussing because the effects of it runs deeper than its face value. Though there are many causes, the key contributor would be mass media broadcasting biased material, creating similar perceptions that are then shared through social media and acted upon in day-to-day lives. This ripple effect doesn't end there though, because these biases don't target imaginary figures. They target real people who have feelings and emotions which are negatively affected and in need of consolation. But before we delve into this, we unpack mass media.
But you don't hear them talking about COVID. COVID. To be specific, COVID-19. That name gets further and further away from China as opposed to calling it the Chinese virus. And what we've done, without question, has more names than any disease in history. I can name Kung Flu.
My name is Alexis Arana, and in this podcast, I will be joined by my fellow classmates, Elvis Solis,
Hello.
Alvin Lee,
Hello.
and Fanny Barkishian.
Hello.
While all of our lives have changed due to the current pandemic, Asian Americans deal with additional problems that stem from remarks which racialize the virus. One of the biggest problems is that these types of comments didn't start in the mainstream media, but rather came from posts on social media and in speeches from our current administration. In one of these tweets posted by Donald Trump on March 16th, he refers to coronavirus as the Chinese virus and remarks how we will powerfully overcome it. Others have had first-hand accounts of these types of statements. Weijia Jiang, White House correspondent for CBS, tweeted the following on March 17th. This morning, a White House official referred to coronavirus as the Kung Flu to my face. Makes me wonder what they're calling it behind my back. The big issue here is that Trump has always shown signs of racial prejudice, if not flat-out racism. On July 2019, to Ilhan Omar and Rashida Tlaib, he tweeted, they should go back and help the totally broken and crime-infested places that they came from. And when he was criticized that these remarks were racist, he doubled down and tweeted, so interesting to see progressive Democrat congresswomen who originally came from countries whose governments are a complete and total catastrophe. The worst, most corrupt and inept anywhere in the world, if they have functioning governments at all. Now loudly and viciously telling the people of the United States, the greatest and most powerful nation on earth, how our government is to be run. These racial comments, along with tones of nationalism, only serve to further legitimize those who share these sentiments. It's almost as if people believe that it's okay for them to think or speak this way just because our president does so. For example, one study done discovered that prior to these incidents, from March 9th to March 15th of this year, there was a total of 16,600 tweets with the phrase Chinese virus or China virus. Donald Trump's original tweet referring to it as Chinese virus was on March 16th of this year. And then from March 19th to March 25th, it increased nearly tenfold to 177,000 cases. In addition to these mentions in social media, news outlets such as Fox have referred to the coronavirus as the Chinese virus several times. They also put out articles at the beginning of the year which implicitly blames Chinese and Chinese Americans for the spread of COVID. One such article titled Coronavirus, Outrage over Chinese Blogger Eating Bat Soup. Fear concerning the ongoing COVID-19 situation and the use of social media and partisan cable TV have served as a catalyst for stigmatization of Asian Americans. While Asian Americans haven't been explicitly blamed by government officials or the media, the comments that have been made are clearly the cause of the current prejudice and increase in hate crimes against Asian Americans. Another glaring issue during the outbreak has been the response by the population in the United States. From refusal to wear masks in public to protest against stay-at-home orders, a large portion of the American public have been completely against orders put in place to protect its people. I can speak firsthand on this because I work in retail. I've been working in retail for a little over 10 years now. And over the last 9 to 10 months, I've had a lot more incidents with customers, a lot more confrontation come up where customers get combative and argumentative just because they refuse to wear a mask, feeling that it's their right as American citizens not to do so.
Yeah.
And I'm sure that these types of incidents happen throughout the country. There was a survey conducted by Brookings Institution of approximately 10,000 people, where about a quarter of them still stated that they refuse to wear masks when they go out in public. When asked why they don't, the majority of them, which makes up about 40%, responded that it's their right as Americans not to wear the mask, which was followed by about 24%, which said that it makes them feel uncomfortable. This individualist mentality is almost completely opposite of the collectivist mentality of many Asian countries. In his article on how cultural differences help Asian countries beat COVID, Jennings wrote that the strength Asian countries have is that the people in these countries are still collectivist in orientation of thought. They listen to government instructions, especially if they are reasonable. In many of these countries, consideration for those around you is more common. I went to Japan at the beginning of the year for 2 weeks, prior to the outbreak being publicized, and face masks were already an everyday thing for most people. People wore them not just to keep themselves from getting sick, but to help prevent others from getting sick as well. In the subways, people refrained from speaking because they were being considerate of others on the train. Simple actions like these helped minimize the spread of COVID from the very beginning.
Following off of what Elvis has said about how the media portrays the virus, I want to dive deeper into the nature of anti-Asian racism in the wake of the coronavirus pandemic. Some questions we may want to look into in this section include: how do you think Asian Americans feel when they have to cough during this outbreak? Is racial profiling prevalent in the media showing Asian wearing masks? And why is there such a big difference in response to the outbreak, and that most Asian countries are seen wearing masks versus, for example, in the US? Recently, there has been a spike of physical and verbal abuse against people who look East Asian, causing both a direct and indirect impact on Asian American communities around the world. When the coronavirus outbreak started in China around early January, the concerns and possibilities of this disease have not yet struck Americans. Many Asian Americans checked their phones to get update on the situations of the outbreak, but not many thought it would threaten them in any way. But when the cases were being discovered in the US, first in Washington state and then many others, there was a rapid wave of fear among Americans that the disease will spread more rapidly within the US. People started dying, anxiety went up, creating more fear, which in turn led to more prejudice against Asians. According to the Washington Post, Asian women report incidents 3 times more than Asian men, so it seems that perpetrators are picking on the more vulnerable people. Also, 2/3 of reports are verbal, and about 1/9 of reports are physical violence, which include being spat at or beat up. This all stems from the perception that people who look East Asian carry the virus. This is a big safety issue concern for Asians. There are stereotypes of Asians when they are seen wearing masks. They are looked at in a funny way, as people who carry disease, or take the matter too seriously. I think the underlying reason for this is the perception of masks. There definitely exists a cultural disconnect between countries in Asia and the US. In Asia, people wear masks to protect themselves and others from danger, whether if that's pollution or disease, while people in the US see wearing masks as, oh, this person has, this disease, so let's stay away from them. So there's this huge report of shunning, which means that Asians are feeling people wanting to move away from them, and they don't have evidence of carrying disease. Because of the rise of anti-Asian xenophobia, many businesses and restaurants are losing business. People are fearful of places with Chinese people, and because of this, there are major economic consequences for small Asian businesses, such as drop sales and having to close down their shops. When dealing with this pandemic, I think we should listen to the history and science rather than looking into who to blame. Our focus right now should be on how to save lives rather than who to blame and pointing fingers. For example, I think it is a good thing that President Trump stopped Chinese citizens from traveling to the US in February to try to prevent an outbreak. I don't think you can really blame him because it was sort of based on reasoning, meaning that he was trying to contain possible cases by looking at where the virus came from. Where President Trump is wrong is his portrayal of the disease to the media, as talked about earlier. People are influenced by the media and go into the streets, and when they see Asians now, they don't ask where they come from or if they're sick, but instead, they judge them by the color of their skin, by their language, or by their country. I think that is a major difference that society needs to differentiate, as people today still continue to face discrimination based on race, ethnicity, appearance, and language. I also think that there is something deeper with the anti-Asian xenophobia, in that other races and ethnicities are also being affected. For example, the question, which state in America are you from, or what country are you from? There is definitely discrimination against people in New York City, Wuhan, or even Italy, where there have been previous major outbreaks.
During the outbreaks of the bubonic plague and SARS years ago, anyone who looked of Asian descent was automatically demonized, and as seen with COVID-19, nothing has changed. We've discussed media portrayals as well as racism and xenophobia they create against the Asian community. So now we question, what are the effects? Living day to day in a pandemic paired with an uprising and protests against anti-Black racism is no walk in the park. In the Brown University Child and Adolescent Behavior Letter, researcher and Dr. Ann Walter notes that she has seen an increase in adverse mental health conditions in adults since the start of sheltering in place. In addition to increases being found in anxiety and depression rates related to trauma, substance use from new and old users as well as suicide are included in these rising numbers. Their rates are found to be higher for people of color because of a large percentage having either lost their job or being essential workers with higher chances of being exposed to the virus. Racial labeling, hate crimes, and the language used by government officials, as mentioned by Elvis, are additional stressors uniquely experienced by people of the Asian community. And with 95% of youth having smartphones or access to one, these stressors affect all age groups as well. Staying indoors or around family and friends does very little to keep away from being confronted when anti-Asian discrimination is on the rise in person and online across multiple sites and social media platforms. This, in combination with the extra time spent indoors because of stay-at-home orders, equals far more time spent online where the exposure to discrimination is unavoidable. Even if you or I are not attacked or discriminated against firsthand, we still experience some effects in seeing it done as onlookers. How can anyone be unfazed or feel detached as if it cannot happen to them when it's happening to others because of the same race or ethnicity that they both share? This possibility is unrealistic. Prior to schools being shut down, my niece came home one day and told me she was playing with her friends at school, and her Asian American friend asked her, without provoke, "Do you think I have the coronavirus?" And although my niece told her no immediately, she responded, "Yes, you do, because I'm Asian." This is completely disheartening to think about. At such a young age, this child is convinced within herself that the world around her sees her as an infected person solely based on her race. Studies have shown that perceived discrimination and race-related stress in Asian Americans leads to anxiety, lowered self-esteem, and suicidal thoughts, to name a few. Trauma passed through generations causes additional damage to children as it increases an imbalance in their emotions. What is happening today robs so many people of happiness tomorrow and in years to come. No race or virus gives reason for the long-term struggle of any human being. For mental health workers, special care and consideration needs to be taken when caring for the Asian community. We are all struggling, but they have been given additional struggles atop what everyone else has. This special consideration needs to go beyond care sessions and onto mainstream media. Show people that they are not alone in their feelings to bring them comfort, but also encouragement to speak up and get help. Outside of the Asian communities, we as onlookers also need to see the special consideration needed so that we can see firsthand how negatively impactful our actions both online and in person may be. Because if it were us or our loved one in the shoes of my niece's friend, we would know just how painful those shoes are and how imperative being relieved of them is.
Thank you all for taking the time to listen to our podcast. Let us stand in solidarity, not to a specific country, race, or religion, but rather to humanity. Nelson Mandela quotes, "The greatest glory in living lies not in never falling, but in rising every time we fall."